Hi, it's Gerald Major, and I'm back with hashtag See Arthritis from the 2019 Canadian Rheumatology Association Allied Health Professionals annual scientific meeting. And I have the pleasure to be sitting beside my new best friend, Sue MacQueen, and you are this year's president of the Allied Health Professional Association.
That's true. Thank you.
So congratulations, and
Yes.
tell us all about yourself.
Well, I'm a physiotherapist with the Arthritis Society. Have been there for 30 years. Started when I was 10, of course. And for the past 10 years, I've been working in an advanced clinician practitioner role. I did the ACPAC program 10 years ago, and I work with adults and pediatrics in arthritis, and throughout that time I've been a member of AHPA.
And so you're kind of jack of all trades a little bit, aren't you?
I'm split personality.
So let's tell us a little bit about who is involved and who are members of AHPA, and what is your objectives or your mission?
Well, the Arthritis Health Professions Association is an interprofessional organization. So we have physiotherapists, occupational therapists, social workers, pharmacists, chiropractors. We have all different, of course, I can't forget nurses. They make up a great portion of our membership. And so our mission is to really build and sustain that community of professionals who provide that care for people with arthritis in Canada. And we do that through knowledge translation, engagement, and interprofessional collaboration.
In a lot of ways, I mean, from a patient perspective and patient groups, I mean, in a lot of ways, your membership provides bridges for us into rheumatology.
Exactly. We value what our patients tell us and what patient groups tell us is important to them, because we want quality of life, good quality of life for patients who live with arthritis. So we can't possibly do that without feedback from patient groups who tell us this is what we need and can you help us with this?
So in the work that you do, what does building, I mean, this year's theme of the CRA is building bridges. So in your work, what does that mean to you?
Well, in my role as president of AHPA, building bridges for me is building bridges with outward. So with other professional groups such as the Canadian Rheumatology Association and other provincial organizations. I think that's really important that we build those bridges so that we can work together on models of care to provide timely and accessible care for people with arthritis. It also means building bridges with all the patient groups that we deal with, because we need to have that line of communication. I think that's so essential.
Yeah, I was very impressed last year. I mean, I haven't been in the space for that long, so things move really fast. And I remember last year's event and just trying to really figure out kind of AHPA and what happens there and so I mean, my knowledge in the last year has sped up dramatically. I had a lot of fun at your event on Tuesday or Wednesday. And as you know, my surgeon was actually there. So you're building bridges into orthopedics.
Well, that's true, because a lot of our patients at some point or another may require some orthopedic surgery. So there's that connection.
Yeah, I found that conversation yesterday very rewarding because we've talked in rheumatology in this community about how to engage orthopedics, and I've spent the last 9 years getting surgeries every single year, and surgery is part of my thing, and I feel that, because I have so many, a lot of people share their opinions with me on surgeries, and it seems that from a patient perspective, there is a sense of pride potentially on how long you can wait and delay your surgery. And And as a person that, left work 9 years ago with 11 surgeries planned, I mean, that type of mentality just doesn't relate to me. So talk about, I guess, the opportunities going forward with surgery in our community and getting information out there to people so they can make informed decisions.
I think when people are looking at surgeries and certainly joint replacements, we always say that your own joint is your best joint. And so we want you to wait a little bit, but it's not, you don't want to wait until you're incapacitated, because then you lose function in your day-to-day life and you actually take a step backwards when you do that. I think the timing is crucial. You don't want to do it too soon just for the fun of it. I'm sure surgery isn't fun, as you would know, but you want to be able to continue doing the things that you need to do and want to do. And let's face it, if someone has pain and that pain is pervasive and affecting their life, I think if surgery can offer some benefit in that, I think that's so important, because the whole goal is to keep people moving and active.
Right. Yeah, I mean, obviously surgery has been part of my life, and even on Wednesday I learned more things just around. So the fact that I don't believe that from a patient perspective we're really understanding the benefits and the need for surgery. And it's not just to have any surgery, but I think when it's time for you to have surgery, you should be okay with having surgery, because then it plays an important role on if you have a blown knee that you're waiting on, then your exercise is compromised. If your exercise is compromised, then you're probably not hungry a whole lot. And if you're not getting nutrition right, then your fatigue would go through the roof and your sleep might not be great.
And you'll be weak.
And it spirals. So in our communities, patients talk to us constantly about the interactions that they get from nurses and pharmacists specifically. So very important roles for patients. I mean, what can you offer on that? Any type of insight, and what's your community saying, specifically those groups?
I know that our nurses play a crucial role. So, for example, in the clinic that I do in London at Children's Hospital, the pediatric clinic, it's so important that we have a nurse case manager that communicates with patients. That's a key role. And pharmacists offer I always tell people pharmacists are their best friends, because they can be such a source of information about medications that may be appropriate or not, and potential side effects.
And also, I mean, from my pharmacist over the years, I've had ideas on medications or needles that ended up being covered under private plans. So I found vitamin D through that route, whereas I was using supplements and they weren't working. So yeah, the value in that is so great. But then let's talk about the access issues that we potentially have with physio and occupational therapists.
Well, in Ontario, where I'm from, outpatient physiotherapy was deregulated years ago, so people have to pay. There are some OHIP-funded clinics, but there's still usually a co-pay. We're very fortunate in Ontario to have the Arthritis Society, the Arthritis Rehabilitation and Education Program, AREP, and the therapists there, physiotherapists, occupational therapists, and we have social workers, that is funded by the Ministry of Health. So people with arthritis can see us without having to pay. And I think that's a really important thing for people to know. We do require a diagnosis of arthritis, of course, of one of the 100 different types of arthritis, but we can see people and it is covered.
Patient-centered care, that term that's been kind of floating around. When I came into this industry maybe 3.5 years ago, I heard that term quite a bit, and I turned to my mentor and said, don't tell me this is a new term. But it seems to have been a new term at that point. But I have seen progression on patient inclusion, and your groups are big parts of that. So what have you seen over the last few years just around patients and how they're included? And
Well, I think one of the important things, 30 years ago, when I started with the Arthritis Society, we had this sort of idea that we knew best and we would tell our patients what to do and they should do it because we know best. And over the years, I've learned a lot. I've learned a lot from my patients who come back to me and say, I've been doing this, this, and this, and I learn a lot from patients. And I've learned that I need to listen. I need to listen to what the patient needs, what they're telling me. Because there's no point in me saying, well, you need to do X, Y, and Z when they want to do A, B, and C. Let's work together. You tell me what's important to you, and I will help you to achieve those goals. So we're kind of goal-centered. What are the goals of the patient sitting in front of us?
And that's a really good comment because, in business, really the best way to understand what your consumers want would be to ask them. And they'll actually tell you. it ends up being pretty easy. So, yes, patients should be included at every level that they can be and where it makes sense. And I think there's a ton to learn. And the fact that you're saying that as a professional, you could imagine the impact that patient groups have on patients. Because, for me, and people learn differently, but for me, when another comorbidity comes up, what I really want to know is how others have handled it and how others have adjusted their lives, or really what to expect, because the uncertainty of chronic illness, no matter what it ends up being, creates anxiety, it creates stress, and when you speak to other patients and you listen, you get that overwhelming feeling that you're not alone, number one, and you have someone to speak to and provide. So I wonder your comments in closing, unless we have anything from the audience, but let's just talk about the value of patient groups to patients and how we intend to use that going forward.
I think it's huge because, just as you said, if you have a question, you might ask me, but you're going to look at me and you're going to say, you've never had, how many, 11 surgeries?
Right.
You've never gone through that. And you want to talk to somebody who's experienced that. But I think it's important to talk to somebody who's experienced it, but is also knowledgeable about sort of the basic science behind things, so you're not led astray. Joe Blow's arthritis website may not be the place for you to go. So having a patient group, like the Canadian Spondylitis Association or the Patient Alliance group, I think that's really important. That's a good group for us to direct people to and say, these people have experienced it and they are engaged with the research community and know what's going on.
And so touching on that, I think we have something really special here happening in arthritis, I believe. I'm not sure if it's here, but so the patient groups that have been part of the Arthritis Alliance of Canada, there's really 5 of us, and we don't compete. We collaborate and we share and we support. And I'm really getting that whole sense, specifically around allied health and rheumatology now, that whole shift is starting to happen. The tools and the materials that we produce on a daily basis come from people within the CRA. And so, it's really nice to see the collaboration that's happening here, the fact that we're building bridges and working together. So this theme this year is very appropriate and very fitting. I think we're doing a fantastic job. Anything in closing, Anita?
We do have one question. Someone wants to learn how they can best prepare for their advanced physiotherapist appointment.
Oh, well, when I see somebody, and if I'm doing a triage, whether or not they're going to be seeing a rheumatologist or orthopedic surgeon, just having a medication list and having the details of what's been going on, maybe even documented. That's really helpful because we don't have hours to spend over history, so getting the highlights of what's been going on, how it started, when it started, was it gradually, sudden, and how it's progressed. That's really important, a list of medications and other health problems.
And when you say triage, can you define what that means for our audience?
So there are two different types of triage that I do, and I have family physicians will often refer people to me and say, can you look at this person and see if they need to go on to a rheumatologist? So that's what I call big T triage, and I do a fairly detailed history and let people know whether I think they would benefit from rheumatology or somewhere else. The other triage, I call it small T triage, and that's when a rheumatologist is overwhelmed with referrals and they say, I can't see this person for 6 months. Can you see them and let me know if they need to be seen sooner? And so that's just a different type. So that's what I mean by triage.
And one last question. Do you see more caregiver groups available for families?
We do. Within the Arthritis Society, we have Project Thrive, and that's we have these events that go on, and we also have Camp Cambria for kids with arthritis, but we have Project Thrive is for parents and children. That's specifically for children who have juvenile arthritis, but sometimes we have families and we have young moms who have arthritis or young dads who have arthritis, and they want to know, how can I, help my kids along the way? And so the Arthritis Society, we work with them, and we also have people who, our social workers will have visits with them.
All right, well, this has been fantastic. I
That's
can't
great.
wait to see what the next year brings for us.
Well, I think it'll be great.
Thank you for your friendship and everything that you do, and good luck.
It's
in
been
the next
great.
year.
It's been great. Thank you.